An OBGYN, or also known as an obstetrician gynecologist, is a physician that takes care of women throughout all stages of their life, specifically their reproductive health, and even when they are pregnant. So, for example, when I was shadowing Dr. Murthy last year, I saw a girl who's only 15 years old with PCOS, or polycystic ovarian syndrome, and we also saw some patients that were all the way up to the age of 80. So in this career, there is a wide range of ages that you work with. But to become an OBGYN, you need to complete 4 years of undergrad, 4 years of medical school, 4 years of residency, and you can even take fellowships beyond that. But to practice as an OBGYN physician, you need to become licensed. And to do this, you need to take the U.S. medical licensing examination. And if you pass that, you will be a part of the American Board of Obstetrics and Gynecology. So for this job, there's a 16% outlook from 2016 to 2026, and this is according to study.com, which is pretty good as we have many people going to medical school and an OBGYN residency currently. I selected this career because I really liked how OBGYNs kind of like bring life into the world, and I also like how they help people with disorders or diseases that it's kind of harder for them to become pregnant, and they can help them overcome that boundary to become pregnant and have children. And I really enjoy that, as it took my mom a long time to become pregnant with me. Some strengths that I have that would help me to become an OBGYN is I have strong communication and critical thinking skills, which is what you really need in this career. So you need to have strong communication skills to be able to tell people, hey, we noticed on your test that you may have this disorder, or this may be going on. You need to have that strength to be able to tell people that, because that's really something that can get very emotional for them. And for critical thinking skills, I believe that this will really help me, as you need to identify, oh, well, maybe we think this is PCOS, or is it endometriosis? Like, you need to be able to decide and make decisions based on the information that you have. So this career fits in the healthcare system because OBGYNs bring life into the world. I mean, many people today would not be in the world without OBGYNs. For example, me, like, I was breech, so I would have, if there wasn't an OBGYN there when my mom was delivering me, I would have been delivered with my feet first, and that would probably bring many complications to it, as you need to have the head first. So OBGYNs really solve problems like this, and they really make sure that the mother and the baby survive through the birthing. But they also help in other things like PCOS or endometriosis, or just like birth control and things like that, not just the pregnancy side. But anyways, in this experience that HOSA has gave me, I've had the opportunity to learn a lot about the career of an OBGYN, and I would just like to thank you for watching this video, watching my skill video, and going over my portfolio.